President Muhammadu Buhari has approved the third phase of national response on coronavirus COVID-19 pandemic outbreak in the country. This was revealed by Mr. Boss Mustafa, chairman of the Presidential Task Force, PTF, on COVID-19 and secretary to the government of the Federation at the PTF daily briefing in Abuja. Speaking on the outcome of a meeting with the president, the SGF had this to say.
Nigerians will all recall that at the onset of the eased lockdown, the Presidential Task Force drafted a three-phase strategy of easing the restrictions ahead of a full reopening of the society and economy. In determining what phase of the strategy to move to, the Presidential Task Force tried to balance the public health considerations and also economic considerations alongside data analysis. The PTF believes that while Nigeria is not ready for full reopening of the economy, there has been sufficient progress to warrant significant further relaxation of the restrictions applied. Based on the foregoing, the Presidential Task Force today submitted its 7th interim report to Mr. President for his consideration and approval. The main thrust of the recommendation is that Nigeria advances to the third phase of eased restrictions with further amendments to address economic, socio-political, and health concerns. This will last till a time when the pandemic is sufficiently controlled in our country. Accordingly, Mr. President has considered and approved the following. 1. Transition to the third phase of the national response to COVID-19 for a period of 4 weeks with effect from tonight, 12:01 a.m. on Friday, 4th of September 2020, in line with amendments to address economic, socio-political, and health considerations reflected in the implementation guidelines. 2. Continued engagement with states and local governments to improve community sensitization on the response and its attendant effects. 3. Maintaining the current non-pharmaceutical interventions nationwide, that is the wearing of masks, maintaining our social distancing, personal hygiene by way of washing of hands, of use of sanitizers, and avoiding crowded environments, and as much as possible, staying at home. 4. Urging the state governments to work with local government authorities in their state to intensify necessary measures, such as contact tracing, grassroots engagement, and risk communication.